All right, well, welcome this lovely team. This is one of our best turnouts we've ever had. And I will say I'm super excited to share with you guys what we're about to see. This is, can you guys see that picture? That's Dr. Axel Martinez, who spoke a couple weeks ago. I thought one of the best talks we had at the Shockwave Business Academy. Just mark October 5th and 6th. It's going to be limited. We'll only have 50 doctors total at this one. Last year we did, I believe, 21. Dr. Brian, if you'd come out and just say, what did you think about that event?
The event was fantastic. It was learned a lot of stuff, and just talking to other doctors from around the country, it helped us solidify a lot of things we were doing. I picked up just little tidbits of information from different people, you know, and the idea is just to get better at doing this, helping more people.
Yeah, that's it. And rubbing shoulders with some of the top doctors in North America doesn't hurt. You had doctors who had $2 and $3 million clinics that were, you know, able to share with us some of their secrets. Dr. Jen, what did you think? Thank you, Brian.
Yep.
I enjoyed it. It was nice being amongst other doctors who do this. I don't often hang out with a bunch of chiropractors, so it was a little weird.
Wait, we had podiatrists, medical doctors, chiros, physios. Please.
Yeah, so I'm a naturopathic doctor, so I tend to hang out with other NDs. So it was an interesting thing for me to be amongst people who just do physical medicine, you know, so much more than I do. You know, I got the Softwave because I had a doctor here who did a lot of physical medicine, then he left, and I had all of his patients, and I didn't want to just send them elsewhere. I wanted to be able to do something for him. And we learned, you know, some physical medicine, but that definitely wasn't my expertise in school. It wasn't something that I really wanted to do. So this has really given me like a good way to help a whole lot of people. And I really appreciate it. My patients, you know, they keep coming back and getting new things fixed. So yeah, my patients love it too.
Okay, great. That's awesome. And it's good to expand your horizon. And so here's the best thing is that, you know, we go to this international shockwave symposium that, you know, will cost you $5,000 or $6,000, $10,000 to go with hotels. And next year it's in Korea, which I don't think I'm going to go. But the following year is in Amsterdam, which I highly recommend. I'd love to have 20 or 30 of our docs there. And I think it's just unbelievable to have 200 different doctors from all over the world that have, you know, the different specialties. You have trauma surgeons, orthopedists, cardiologists that are all focusing on creating Softwave and Shockwave and emerging it to a higher level. So, you know, excellent opportunities for us to learn from some of the best people on the planet. And I just really, my favorite thing is, you know, the lunches, the after hours, the dinners, and just the social grouping. So, you know, my focus for 2023 is really going to be adding clinical proficiency to our wonderful army of doctors. And, you know, we will see some of the toughest cases in your community that are going to walk through your doors. You know, we're lucky enough to have been the first chiropractic group in Atlanta, in the Southeast, North America, wherever you want. So for 6 years, we've developed a good repertoire. John Warlick has introduced me to some of the finest doctors in the Southeast as well. This is young Tate, and she is a 26-year-old female. Amazing. She actually went into the Peace Corps right after college, and she worked very physical, helping farm and teach and do all these wonderful things. She's just a great young lady. And at 24, she took a job in DC as a teacher in a elementary high school setting. And she was coming into work one day in May this year, and she had a big backpack, and she had missed the day before. She wasn't feeling good. And she literally took her backpack off, and something in her neck moved a little bit weird. She heard a pop, and she fell to the floor. And she was literally a quadriplegic at that point. Okay. And, I have 3 daughters, 26, 24, 22. So they just hit home for me. And it killed me to see or hear her story. Thank God she had a world-renowned neurosurgeon in DC that did immediate surgery on her. And they found that she had a large disc bulge at C5, C6 that had sequestered and put pressure on her spinal cord. And as you know, the outer tracts of the spinal cord will hit or go to the legs and feet. So she was a full quadriplegic, and they did surgery, and they were able to stabilize that area. They went right through the front. You can see her little scar there, and they were able to create some stability. And the neurosurgeon said he took out one of the largest chunks of fragments that he'd ever seen in over 2 decades of practice. Her dad was lucky enough to get her into Shepherd Spine Center, which is here in Atlanta. And as you may know or may not know, it's one of the 10 top rehab hospitals in the country and one of the top 2 for paralysis. Got her in by May 20th, literally 8 days later. And from May 20th to August 20th, they worked with her. She went from a quadriplegic to a paraplegic. So when she came in, she had use of her upper extremities. Now, this is a tough case. Now, she had been discharged from Shepherd's Spine Center, and her father had found us through his network. And even though Shepherd Spine Center has one of our orthogoals in their facility, they won't use it on the spine yet. Okay. So that was concerning to the dad, because once he found out about our technology, he couldn't believe he was lucky enough to be at a hospital that had it, but they wouldn't use it. Now, why would you think they wouldn't use it? Who would like to raise their hand or unmute and tell me?
I don't know, maybe they didn't, no published studies, they considered it to be too high risk, but this seems like a, compassionate use situation. So I don't know why they wouldn't.
That sounds like Dan McCarthy. Is that right, Dan?
100% correct.
Dan, what do you mean no published studies? I mean,
I would say, yes, there's published studies, but
yes, the spinal cord injury, the pilot study, the white paper. You're right.
Many studies, but I think this probably has a lot to do with like insurance dollars, or they consider it to be too experimental for some regions to
Very
want
good. You got it, Dan. That's right. And it's a board. It's a not-for-profit, and what's the worst thing that happened? She becomes paralyzed.
They get better. Yeah, so they get
right.
better.
So, and I've got some tough cases I'm going to show you along the way. I mean, but this is scary, right? When a hospital won't work on her and the family sends her to us, we want to do some work, right? So, obviously we wanted to make sure that she met all the criteria. The fact that she had gone from a quad to a paraplegic was pretty exciting. There was no trauma involved with this. She's very lucky. And I'm seeing if okay, so now, one of the things we did is, what did I do? I started centrally, okay? And she had better movement in her right hand. So we started with her left shoulder and arm. And I'm going to show you some of the treatments that we did. It's no different than what you guys are doing. And
like either like more pounding, yeah.
Which I want fasciculation stuff. So I'm telling Dr. Axel, we're going to be looking for fasciculation. And again, same thing with a stroke patient. All right. And then we did some treatments right on her cervical spine, and then we went to her lumbar spine, okay? And you'll see here how we addressed it. And we're gonna do another 400. But you want me to really focus on left side?
You have to increase pain and.
And Dr. Axel had done
Everything on the left side.
she doesn't feel it as much. He went through a full neurological upper and lower extremity. And, you know, we found she had decreased sensitivity, hyposensitivity on the left side. And she was actually starting to get certain sensitivity on the right side from his findings. Now we're going up and down the spine. This is the same thing I would do, say, the couple other tough cases we've seen is people who've had Harrington rods. And they're young, usually in their teens, that have had these two metal rods placed in to straighten out their spine. I'm going to make a prediction today that I think every patient that has had a Harrington rod should find a Softwave provider, because it's an amazing relief what I see, what I've seen clinically in our clinics, like when these patients jump up. Now, again, Tate had no issues with her lower extremities. Everything was coming from her neck, but we were trying to stimulate the central nervous system, and then we worked distally, and I'll show you that. And are you hypersensitive on the left?
Right.
That's right. She had more pain on the right. So we did that. And then we went to her feet, and we started on the left foot. Okay. And it might be here you start seeing some of the What's that? You see that?
That was a big one.
That was a fasciculation. Let me tell you, you know you're on the right area when you start seeing those fasciculations. That's an important point. Especially stroke patients too.
Singles.
Like that. See that? You get that on tape?
I don't know what I'm taping. I'm just taping this whole thing, so.
That's her mom.
Watch your spine, watch your legs. You can get it again. What's her body's reaction?
Okay.
She's definitely feeling it in her brain. Whoop, see that?
Oh, yeah.
So if they feel it, it's actually going up through the sensory and pathways and motor pathways and stimulating that part of the brain. So that was exciting. And let me see if I can get this one. Hold on, sorry. Now we went to the anterior surface.
Is it tender or is it just?
Just bad one.
You feel it?
Oh,
You feel pressure?
no.
But you can see her buttocks actually jumping.
What did you get to be, John?
Yeah.
Yes. Go back.
So she can feel vibration.
Feel bit there. Pretty cool. Pain? No. Feel my finger?
No.
So what we want to teach you is how to create case studies, right? And how do we document this as well? I got a video from her dad, which I'm not able to share right now, but just 1 month ago, she was actually working with her physical therapist and she's standing. She's moving from a seated to a standing position on her own. So it's exciting to kind of to see what's happening as we work through this. This is a new TikTok I got. You should watch that. And again, most of the stuff I'm doing is we're videotaping these patients before, during, and after. This is going to be one of the most difficult cases. I don't think I've flagged her picture yet, but this is a 94-year-old patient who has one of the worst spines I've ever seen. And she's so sweet, 94 years old. I met her down in Fort Walton Beach. This is one of the therapists. This is Dr. Ed Frisbee's office. And I'm hoping I can show you what her spine looks like and what we had to do to address that. That would be the next one. But just some really great stuff. This patient was scheduled for a hip replacement, but she's too heavy. So she can't move, right? She's in a terrible conundrum. She can't exercise because she's in pain. She can't lose weight, and she can't have the surgery. Softwave was like her last hope.
What? What?
Yeah,
What are you saying?
well, it's not as painful. I mean, I'm not running any races. but-
No, that's okay. I want you to take bigger steps though now, right? I'm gonna let you use that today. Like heel to toe, very good. That's great. That's awesome. Come sit right on this little bench.
Okay.
Getting up was very difficult for her.
Russ, how's it feel when you're sitting?
Matt, what did you treat on her? Did you treat like her ankle or like her knee, or what were you treating?
I have the treatment video. I treated her. So it was a hip replacement, right? But where do we want to go? Like everything starts with the central nervous system, right? That's the river of life. So this is the treatment I did. And this was just last week.
Now I got to stay there almost 4 or 5 seconds, which I like. Anything you need in this area?
No.
Good. The more pain you have during the treatment, the better outcome. He said that already? Good.
See, the doctors, they prepare these patients. Like you guys have become such wonderful educators, and that is amazing. This isn't very difficult to work, right? To understand the concept. And the thing I love most about this is that there is literally, we know within 4 or 5 minutes if a patient is a candidate for this. Would you guys agree? Isn't that one of the coolest things? Yeah, Dan, I like seeing you, Dan. You're a good looking guy. Please don't put your black, your screen on when you're coming in on these calls.
Thanks, Matt.
So, Dan works as well in a pain clinic with Dr. Rob Windsor. So he's seeing some difficult cases. And so I start centrally, and then I might go, we worked on her hip right after this, on the bad hip that needed. And again, hips are the most difficult. Put a hand up, right? Grade 3, grade 4, we're just trying to buy these people some time. And you almost have to be in a figure 4 patient supine to try to get into that area. But really what I'm doing with the hips is I'm finding that greater trochanter, and I'm putting as much energy and power into that joint. And I'm hoping it dissipates and the vibratory senses get all the way through the bone. Now, will it change the resurface of that if there's a mushroom cap? No. But can I give these patients some relief for 2 days, 5 days, 10 days? Yes, that's the key. We're not regenerating hips here. I saw someone else that said, oh, got a complete torn labrum in the shoulder. How many think that we can help that?
Well, I mean, you can't fix it, but you can certainly help the inflammatory process, which is going to not potentiate the, it's the traumatic arthropathy that begets the, arthritic arthropathy. So
That's right. So
arrest the inflammation.
So again, we're tissue regeneration. We're not raising people from the dead. We're not repairing, taking ligaments that are torn and bringing them together. That's not happening, okay? That is a surgical intervention. And the rule of thumb is after 3 sessions, if these patients aren't getting better, release them. You understand? In 3 visits, if you're doing this right with enough energy, you should be at 50% pain reduction. Now, some people, some of our technicians, again, why do I like chiropractors and osteopaths and orthopedists and massage therapists to run this? Because, you have to feel it to heal it. And some of you are just too damn nice. Like, oh, we started out with 10, but it was too painful. So then we lowered it to 8 and then the 7 on the third visit and then 5. You're wasting the person's time. And they kept getting worse and worse. I'm like, you're doing a disservice if you can't keep that energy level at 9 or 10, especially thinking about the depth that you have to get in there. Can you imagine if you're, so energy level is how deep that the Softwave is going to go. So if you're at a 10 doing a diagnostic test, like mapping out a knee or a shoulder, and they're like, oh, okay, stop, you rest. Mrs. Smith, do you think this is a normal joint or abnormal? Oh, it's abnormal, it's abnormal. Okay, I'm going to decrease it down to a 9. I'm turning down the energy level to more of a healing mode. And we're going to start your first treatment. Do I have to pay more? No, that's all part of this introductory offer. Okay, the reason you lower the energy is so you can hover over those hot spots. You float like a butterfly. Where it stings, you want to hover a little more, right? So your first pass, you might only be able to throw those hot spots for 2 seconds. The next pass, you might be over those hot spots for 3 seconds. If you stayed for 8 to 10 seconds, they would pass out. Your body will, the reason why we have a vasovagal response, or Dan, I'm missing the word. If we go into shock, right? That's the body's response from dealing with a lot of pain. And you can actually, I put people into shock before, okay? It's not fun watching them almost throw up. And he was one of my best friends from high school. So, this is important concepts to understand. So you have to find, and this is powerful, intelligent energy. I must say it every other Tuesday we're on. You have to be mindful and respectful, but you also have to deliver enough energy to get that soft wave deep enough, right? So if energy level 16 is going to go the depth of a soup can in there, and most of the time we're at energy level 10, which is like a family style tuna fish can, then you got to be at 9 or 10, sometimes 11. This lady right here, I was 11 or 12. Deep what we have to go through. So just remember that and just be aware of it. So again, I want to be respectful of time. I want to open up. Let's see if we have any questions. Caleb Davis, some work comps have removable backs if you're willing to dig into the LOL. Okay. Back braces? I'm not sure what that was.
All right, that was a question pertaining to some of the spinal injury patients and how to treat their spine. And I was mentioning I've found success in utilizing inclined benches. It's easy to transfer patients onto them, and then you can use that bench to then allow the patient to lean onto a hydraulic table. So you can get them into positions where they're relatively comfortable, and yet you can still access their spine.
Thank you,
I was responding to somebody else there.
That's awesome. What's your general intensity? Very good. So, these are important things to understand. Remember, I created the less is more concept because we had a limited number of soft waves per each probe. Okay. So if you understand the history of lithotripsy, and Dan, you can back me up on this, but 40 years ago, even 30 years ago, 20 years ago, lithotripsy uses 20,000 shock waves. Takes 35 to 40 minutes to administer. When they came out with the second and third generation, the orthotripsy, which was for non-healing fractures, those were 15 or 20-minute treatments. High intensity, did not have to knock them out. The OrthoGold, the UroGold, the DermaGold are third generation lithotripsies. They are low intensity, meaning you don't have to knock a person out with anesthetics. Our energy level is 1 to 16 for a reason. Okay. And up until a few months ago, energy levels 11 and above, you're wearing down that spark plug at what? 33% faster. So I'm a cheap ass, right? I didn't want to waste all my energy level or shock waves on, some big patients. So I taught my doctors and most of you on this call how to microdose this and how to create a positive biological effect. I'm super excited to tell you that there's been amazing advancements with our German counterparts at MTS, and they've literally put together a couple new models that are going to be coming out. And so, hold on, my kids are yelling in the background. But what's about to happen is in January, we're going to be releasing the OrthoGold 350. And that 350 is going to have over 700 treatments per probe, as opposed to 200 to 250 with the current model, OrthoGold 100. Nicole Parent looks very excited about this. She's excited. She's jumping around. Her camera's moving. What does that mean for us? Do you guys understand? And with the new OrthoGold 350, you can have energy levels 11 to 16 and still have 700 treatments. Does that get you excited, Nicole? Yes.
Yes, it does.
Why is that?
Good
Why
question.
why do you get excited? Why? I hope you understand.
Well, I don't know. When you were just talking about everything, it just gets me excited just because we're helping. We've had a lot of patients through the holiday season. They've been working really hard and everything. And just to see them overall, just to see them find relief, especially the bigger patients, the more difficult cases, it just makes me smile and excited for them.
Sorry, I just had to say good night to my children who are leaving. But yeah, so what that means is, and I got to play around with this device about a year and a half ago. We were the first in the United States to play with it. And let me tell you, it's pretty nice because it's going to lower the cost of treatment for each patient. And we will have an upgrade program. Don't feel like you guys are going to be left out. But it's going to be obviously a little more expensive. And we also probably by March or April, we're going to have a device that will have 500,000 shock waves. Each probe will get 1,000 treatments. And that will be more for the pro teams, trauma centers. And so that's really exciting. And then at some point, mid to end of year, we'll have devices that will have 1 million soft waves per probe. So it's really exciting to see the progression and the engineering feats that the MTS and our counterparts are putting together, and shout out to them. So I do believe that the cost of treatments will also go down, and we'll get, you know, for a 700 Softwave, 700 treatments, most people are going through one probe a month. And so that means they could go 3 months before they have to change out a probe. So that's exciting. So talk to me, any of you that are interested, you can reach out to me. I'm also excited about our affiliate program that's coming out. We're going to have an affiliate sub-distributorship. That means every single one of you can help place this device in more providers across the country. And we'll be rolling that out at the end of this week. But basically, we'll have a tier system, 1 through 4. You'll get compensated at basically $3,500 per device that you help refer or sell. And then 5 through 9, you'll be at $5,000. And at that point, we expect you to be doing more. For the 3,500, you're just going to be making a referral, group text. Many of you have already helped sell at least one device. But this is, the way you do it is you just set up a group text. You introduce, say, Dr. Smith to me, and then I show you the steps and processes that you guys all went through to purchase the device. It's really, you know, doing your research and doing a fact finding. And then after you've helped sell 9 devices, you become a sub-digital distributor, and you'll be getting 10% of the cost, the price of that sale. So I'm excited. I think that a lot of you already are great ambassadors, but now we want to show you how to help us, you know, share this technology. Any questions?
I got a quick question about the OrthoGold 350. This still same exact technology, right? Is this just better engineering for the probes to have longer life?
Totally different device. Well, I mean, it's the footprint's the same, but we're going to have a different capacitor, the flux energy, flux. It sounds like I'm talking from Back to the Future, but it's a flux energy capacitor that will be changing. It's 6 pounds heavier. It's a different probe altogether, applicator. So, and again, if you're thinking like, oh my God, I need to upgrade, not necessarily. We know what the target should be, and you should be going through at least 2 to 3 probes per month if you're ready to make that upgrade. And we'll have a wonderful trade-in program, and I'll make that. That will be probably our first call of 2023, where I go through what are your levels. And Dr. Ort was supposed to be on here, but unfortunately his sister-in-law is sick, so they had to go to Tampa. So keep her in your prayers. So that's exciting. We've got anybody having any issues, anybody in their town that has a turkey wave, I call it, or the stem wave. Anybody we know of? Anybody had to deal with it? Unmute and ask me any questions. We want to know if one comes into your town, please. Do you guys know what I'm talking about?
I see it. I'm bombarded with their ads. I just don't know what they're claiming their device does.
All right, I'm going to stop